Hello, I'm Digital Correspondent Sarah Strackhouse for Real News Communications Network. Today we're talking to Dr. Johnson from Johnson Medical Associates a little bit about cerebral palsy. How are you, Dr. Johnson?
I'm great, thank you.
Yeah, absolutely. So cerebral palsy, I think it's a term we've heard. Sometimes we can identify it if we see it in another person, but what is it actually?
Well, cerebral palsy is brain damage from birth, from a birth process or what's happened prior to the birth process. And so these people may not function as well from a neurocognitive standpoint. They're floppy babies, spastic babies, babies that don't nurse well, have trouble swallowing, and just do not progress well. So it's actually a kind of we used to call it old term birth injury, and then it's called cerebral palsy because they do have palsy, spasm type motions and extremities, which is kind of indicative of what has happened in the end result.
Sure, and it's a degenerative disease, right? It continually gets worse?
Well, not necessarily. I mean, the damage has been done, and they just don't progress and mature normally and grow normally.
Okay.
So they are, and it's much slower. So they may have slow progress in their maturing process as they grow. And what has happened is that the brain has lost either oxygen or had some brain trauma during the birthing process.
Sure.
Now they are putting a lot of these all in what they call the autism spectrum.
Okay.
So that they fit in those kids that are not functioning well, that they're slow learners, they have poor attention spans, and only by going back and taking a history about when did your child first start to have problems, can you really sort out what's going on. If they said, well, he's had problems since birth, then you got to go back and look at what the birthing situation was, the APGAR was, if there's any trauma that the child had or the cord was wrapped around the neck, they were hypoxic, and see then what is that situation. For years in Florida, they started treating cerebral palsy patients with hyperbaric, and that's over 20 years ago.
Right.
And they found that they can wake up some of those cells that have been damaged using hyperbaric oxygen therapy in a chamber over a period of time, sequential treatment.
In that case, would they continue to progress and learn and as they get older?
Yes. Then as you wake up the cells and heal those cells, then their developmental processes speed up, spasticity calms down, motor function is improved. In the real severe kids, you're never able to get them back to normal, but you get some of the less acceptable symptoms calm down.
Sure.
So they have better eye contact, they aren't drooling, they can hold their head up, and they aren't as spastic. Other ones that aren't so severe can progress to a greater extent.
Okay, well, if people have questions maybe about trying to get a hyperbaric treatment or just wanting to find out more in general about some of the options they have, what's the best way to get a hold of you?
Best way is look at the website, Johnson Medical Associates, or call my office, 972-479-0400.
All right, Dr. Johnson, thanks so much.
Thank you.
All right, for Real News, I'm Sarah Strackhouse.